Start.
Yeah.
You can hear me, na?
Yes, doctor. Okay, we are live now. Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory, and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see hair problems occurring at 25 to 35 years old people, and most of these problems, if identified early, can be managed well, and much of the hair loss can be avoided. Today, we have with us Dr. Imran Wali, is a well-known dermatologist and has been practicing medicine for over many years now. He's M.B.B.S, M.D. And specializes in dermatology, cosmetology, and hair transplant. He's currently practicing as consultant dermatology at Manipal Hospital and also at Apollo Clinic, Newtown, West Kolkata, West Bengal. Dr. Imran Wali has dedicated his career to diagnosing and treating a wide range of hair and skin conditions while providing personalized healthcare services to his patient. He takes time to listen to his patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Imran Wali is aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. Imran Wali, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Thank you very much, Mona. I'm really honored by you, your group, and also the IPCA. And I'm there to answer any questions about the hair fall. I'm ready.
Yeah. So thank you so much, Dr. Hamza जुड़ने के लिए बहुत बहुत शुक्रिया. It is always good to connect with you and bust our myths around and get more knowledge and more mm, take care of our skin and hair care. So, doctor, today we are going to talk about hair care in current scenario. And whenever we talk about hair care in current scenario, the very common problem which is faced by all of us is like hair loss, which is irrespective of gender and age. So, can you please enlighten us like what's normal and when to be concerned for?
See, now I'm practicing for the last 34 years, and what I'm seeing for the last 5 to 10 years now is a huge fall of hair from both sexes, whether it is the males or the females. And there are a lot of factors which play a very important role in this fall of hair. One is the environmental condition, one is the iron in water, one is the PCOD, PCOS, your thyroid problem, one is severe stress, one is proper improper food habit. And of course, coffee, caffeine, cigarette, alcohol, all these kind of things precipitate hair fall, and lack of exercise, which is also very important. So now, when a patient comes with me in the hair fall, like today I did, I out of say 15 patients, 5 or 6 of them were for hair fall. The hair fall also has a lot of negative impact in the mental psyche of a patient.
Mm-hmm.
You know, if a patient sees, young patient sees a lot of hair fall, that's because of our fault also, overexposure of misinformation, lot of nonsense which goes on in the name of all this, this channels and YouTubes and this and that kind of things. And people don't even have the common sense to go to the consult dermatologist. And before that, they start experimenting on various things, straightening of the hair, etc. Now, as I said, that hair fall is a vast subject,
Mm-hmm.
and when the patient comes to us, we see the problem of the patient, and then we pass our judgment, and that's how we start treatment of the patient. Because say hair fall, see, it all depends on how much of hair falls. For a
Mm-hmm.
person who has 50 hair fall a day can be dangerous. For a person who has 100 hair fall a day can be normal. It all depends on the density and the volume of the hair, how much of hair you have. So it
Mm-hmm.
all depends on how much is the level of the hair fall. All these 100 hair falls, 50 hair falls is not a. If I have 100 hair in my hair, and if
Uh-huh.
100 hair falls, where will my hair be? I will be soon at an airport,
Mm.
right?
Yeah.
So So we have to train the patient, but for my side, I always emphasize on proper food habits. That is very
Mhm.
important. And of
Mhm.
course, you know that hair fall is also to a
Yeah.
certain extent genetic. It
Mhm.
is a bit, not bit, it's genetic. It is, and the problem is now what we are seeing is a lot of misinformation, a lot of stupid information, lot of idiotic information about hair fall and this and that. Like
Mhm.
people when they say that if we shampoo, you will lose a lot of hair. There's nothing. It's not that if you shampoo, you will lose hair. You will lose
Mhm.
hair anyway. I shampoo 3 times a day. I'm not a bald in front of you. This is my original hair, right? And
Mhm.
even if you oil your hair, doesn't mean your hair is going to grow. This is not rice plantation that you put fertilizer
Mhm.
and it becomes a rice. So these are the myths which you have to, yeah. And a lot of people do a lot of this straightening of the hair, coloring of the hair, a lot of other
Mhm.
things which they do, and so this is causing a lot of problems. So I
Mhm.
think, have you understood what I've said? So it is
Yes,
it is
yes,
not
doctor.
that.
Yes. Yeah, very interesting, doctor. So, doctor, like you said, that lifestyle plays an important role. So, can you please, like, because nowadays we are all like very busy, don't have time to eat and don't have time to sleep, and whatever it is available, we eat. So, like, how does this lifestyle play a role in hair health?
It is very important. You must respect your hair. If you
Mm-hmm.
don't respect your hair is not going to respect you. It's once in a lifetime which you have got when you were born. And we
Mm-hmm.
have this habit of saying that, I have very thin hair. If you have thin hair from the very growth, you will always
Mm-hmm.
have thin hair till you die. Your hair cannot be thick or thin. It's not a tree. It's not a plant which becomes a tree.
Mm-hmm.
It might reduce. I have thick hair. I might lose hair, but I will die with thick hair.
Mm-hmm.
Someone else has thin hair. The
Mm-hmm.
reduction in thin hair, but that person will go away with thin hair. That hair
Okay.
cannot be thick.
Mm-hmm.
You understand what I'm saying? It will
Mm-hmm.
be the diameter will be the same as what it is. Other
Mm-hmm.
than the child hair or baby hair, that of course evolves, right?
Mm-hmm.
That evolves to adult hair. So the adult hair, if you have thin hair, you will get thin hair. If you have
Mm-hmm.
thick hair or curly hair, you will get curly hair unless you do some thing and straighten it out and some other thing. Uh, so lifestyle plays a very important role. Early good food, early sleep, 7 hours, 8 hours, everything needs rest.
Mm-hmm.
Proper shampooing of the hair to clean your scalp of dandruff, of
Mm-hmm.
pollution.
Mm-hmm.
Uh, if you want to oil, I am not into much into oiling because I find it very sticky. But anyway, but I am very much into shampooing because I shampoo because my hair is very thick, so it becomes very sticky, and I'm in a very pollutant city, so I have
Mm-hmm.
to do that. So that's it. These are the kind of things which you have to. I give advices, very simple advices, which is very effective. I don't into. I'm not into the fancy things, to be very honest with you. And of
Mhm,
course, I give a lot of medicines. Your company also has a lot of very good medicines which I give. I'm
mhm,
trying out this serum which is there, which
mhm,
is very good in your this thing. So let's see. Tell me
mhm.
next.
Okay, quite interesting, doctor. So, doctor, like you said, there are a lot of myths, and there are also very lot of myths about medical treatment available. Like, people are always confused what is right, what is wrong. So, can you please enlighten us with your profound experience? Like, what are the medical treatment options available for like hair loss or hair management, like surgical, non-surgical, or any other? Is there?
See, one is though you take that biotin tablets, which is supplements which your company had, which is very good. Okay,
Mm-hmm.
that's very good. You have to have patience. You can't have an in one day. You can't have a growth of hair. It's not an Amazon. It's
Mm-hmm.
not the Sundarban, na. You have to
Mm-hmm.
take care of this one. You have to eat properly. You have to exercise. It's a whole gamut of things. It's not one thing,
Mm-hmm.
right? Then you must take. There are certain lotions which is
Mm-hmm.
there, which is very good for your hair. You have in your pharmacy,
Mhm,
your company also. You have a lot of serums which is very good for the hair. So
mhm,
which I am writing now, which is very good. I've
mm,
seen good
mm,
results.
mhm,
So sorry, there is no
mm,
fixed benchmark that this is the thing which is going to work, this is not
mm,
going to work. It will work on someone, it will not work on someone. If you have someone who is a total alopecia area, do you think anything is
mm,
going to work on that patient? No, right?
okay.
And of
Mhm,
course, then there are the surgical procedures, then there
okay.
are the wigs which you apply, which you put it
Mhm, mhm,
on your scalp. So there are these PRPs, there are these
mhm,
intralesional procedures. There's a lot. It
mhm,
all depends on the condition of the patient, the situation of the patient.
Mm-hmm.
And so various fact parameters are there whether the patient is diabetic or not diabetic. So these are the things which is very important,
Okay. Mm-hmm.
right?
Mm-hmm. Okay, very interesting, doctor. So it's about the root cause which can help us, and it's better to visit the doctor. So, doctor, like there is one word called nutraceutical, which is getting a lot of focus nowadays. Like people are very fond of it. So, can you please let us know like what is this nutraceutical and what is the role of this nutraceuticals in hair health?
Nutraceuticals are like, it's like it has a lot of vitamins, it has got biotin,
Mm-hmm.
and these are very important things. And this is also time tested and it doesn't, and there's no side effects for it.
Mm-hmm.
Okay? So
Mm-hmm.
we are always giving these medicines which are very good. You
Mm-hmm.
have the, you have a lot of them. You have
Mm-hmm.
Kera, then you have the Kera Black. You have a lot of them which are very good medicines which has been there for a long time. So these are all time tested medicines which we give. And
Mm-hmm.
I'm not much into the I don't know, there are so a lot of other medicines like finasteride and all. I'm much more into this nutraceutical, which is quite good and effective also.
Mm-hmm.
Okay? So
Mm-hmm.
these are the things.
Okay. Okay, so doctor, there are so many herbal plant extract and phytoconstituent and these plant extract like grape seeds and omega fatty acids. So do they promote hair growth and can are they very useful in managing alopecia? Because so many people are like there is so many information that they can help. So what's the fact behind this?
See, if you say something is good, tomorrow you say that this is not good. Then the next day you say this is good. So where you? I
Yeah.
always believe in time tested things, and the things which I am telling you, Mona, is the ones which I practice for the last 34, 35 years.
Mm-hmm.
So today, if someone says apple is good for the hair, so I will tell the patient to apply apple on the head. It's
Mm-hmm.
like that. But
Mm-hmm.
there are certain extracts which, of course, work to a certain extent. I'm not very sure to how much extent. See, the fact of the matter is,
Mm-hmm.
we are. It is still a very unknown territory.
Mm-hmm.
Okay, so
Yeah.
we are always exploring things, and sometimes we get the bang target,
Mhm.
bullseye, and sometimes we don't. Right?
Mhm. Mhm.
There is no hard and fast rule. There is no hard and fast thing that this is the panacea. This is the
Mhm.
benchmark. You understand
Mhm.
what I'm saying? So there are a lot of
Mhm.
factors which you have to understand before you start the treatment of the hair treatment. That's the important part. Okay.
Mhm.
And nowadays, which you see, a lot of these people have a lot of these thyroid problems.
Mhm.
Thyroid problem, like suppose I'll tell you, thyroid problem definitely causes hair fall,
Mhm.
right? One of the initiators, one of the factors.
Yeah.
Post cancer causes, post pregnancy causes, post cancer treatment causes, post
Mhm.
any chemo causes. So because that means what? What is it pointing to? It is
Mhm.
pointing to your immunity.
Mhm.
So if you have a bad immunity, you will have loss of hair.
Mhm.
But
Yeah.
that does not rule out the factor that a person with genetic alopecia, that
Mhm.
person will have alopecia. You know,
Okay. Okay.
like I can tell you from my side, my father, when he
Mhm.
expired, he was also a world famous dermatologist, Professor M.B.B.S. You are from Bombay, right?
Yeah. Yeah. Yeah.
Hmm. So he was installed the president in Bombay, Professor M.B.B.S. in
Mhm.
'89.
Mhm.
That time it was Bombay. He
Mhm.
had his when he died, he had his hair full of hair. I mean, he had his scalp full of hair. So
Mhm.
one thing is guarantee, I will never be a bald. I'll die with my hair on.
Mhm.
But you understand what I'm saying? So these
Yeah.
are certain things which is genetic also, na?
Mm. Yeah. Yeah, that's quite fact which you have told us. Like there are, it's the genetic also. So, doctor, there are so many nutrients, and you said that diet is also important. So we are quite confused about like micronutrients. So can you please enlighten us? Like, what is this micronutrients and the role of micronutrients in hair health?
Micronutrients, macro, all these nutrients are more or less the same. You have all of them. You have calcium, pantothenate, you have biotin, you have a lot of magnesium, you have a lot of other things which are always there. So this
Mm-hmm.
micro, it doesn't make much of a difference. It's the thing is, it's a wholesome capsule. When you're taking the capsule, It's a conglomerate of so many things
Mm-hmm.
which you're taking, right?
Yeah.
So, and if you take it in a sustained way, it is a very good thing. It is a good
Mm-hmm.
thing. I'm writing to the uh, capsule for the hair. So that is fine.
Okay.
That's a very good that's a very good sign,
Mm.
and it is still have a long way to go. But I think we should cover that area.
Okay. 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 Quite interesting, doctor. So, doctor, after hair loss, there is another very common problem which is faced by all of us is the dandruff. So, can you please tell us how important is the dandruff for the treatment part, and can dandruff cause hair fall?
Dandruff will always cause hair fall because it's a coating on the scalp, right?
Mm-hmm. Mm-hmm.
So dandruff is what? It's a fungal problem, seborrheic dermatitis, or
Mm-hmm.
this thing. So we remove the dandruff by various lotions which we have.
Okay.
Okay, various topical steroids, we have lotions, liquids, we remove it.
Mm-hmm.
We have seen that with, see, like I always, if I give a hair treatment, I give with the cosmeceutical, I give these lotions
Okay.
to reduce the dandruff. Because if I
Mm-hmm.
don't reduce the dandruff, then I will not be able to achieve my
Mm-hmm.
result. ठीक है ना?
Okay.
So
Mm-hmm.
that is how we keep on going, right?
Mm-hmm.
That is the thing. So these are the things you have to understand that
Mm-hmm.
plays a very important role. People don't
Mm-hmm.
maintain their hair. That is the problem.
Yeah.
They don't
Yeah.
respect their hair. I've seen enough people who are from very high established year of the family. They are full of dandruff, even
Mm-hmm.
lice, you know.
Okay.
So we
Yeah.
have to get rid of that. It's as if that. So we have to. When I see the patient, I see in totality.
Okay. Mm-hmm.
Okay.
Okay. Okay, quite interesting, doctor. So, doctor, nowadays we are all stressed out, and stress is something which is unavoidable. So, is there any impact of stress in our hair health?
Very much.
Okay.
So don't stress yourself. Don't overwork yourself. It's not worth it. You are
Okay. So,
working in companies,
yeah.
so don't stress yourself. Do yoga, be happy,
Mm-hmm.
take care of your hair, eat properly, sleep properly.
Mm-hmm.
End of the day, you have to have a good health to work also, na?
Yeah.
So these are the very simple things. I don't see if you expect that I'm going to give you some magic formula, I am not the person to give. I don't
Mm-hmm.
bullshit. Okay? I'm
Mm-hmm.
telling you what is a fact.
Mm-hmm.
So you have to cut down on your this thing. Cut down, eat as much as you can. Don't overeat. You'll get a stomach upset. It's like that.
Mm-hmm.
You want something, you get the pay the price of it. So I am very relaxed in my life.
Yeah. Yeah.
Okay.
Yeah.
So that is it.
Mm-hmm.
My picture coming out well?
Yes, doctor. We can
Are you
see that.
sure?
Yeah.
Because I don't look so bad as what it is showing in the picture. I'm pretty good looking. That's why.
Yes, doctor, we know that you're pretty good looking. And I,
It's looking horrible. Anyway, I forget it. I'm just joking. Bolo, tell then.
yeah, I think you must be having a lot of patience today. Anyways, so doctor, you said that oiling hair is not good or something, but
No, I didn't say
there
oiling
is
is bad.
something.
I
Yeah,
don't
yeah,
like
there is
oiling.
something which is applied by all the mothers from like ages. Like they tell
Look,
that the
see,
oil.
see,
So
see,
can you
see,
please tell like what's the fact
see,
behind this? Yeah.
see, yes, yes. Oiling is just to set your hair, nothing else.
Oh,
It
oh.
is not oiling is then to we all the people who are bald in this world, they would have poured oil like nobody's business on the head and
Yeah.
hair would have grown. Will it grow? Tell me that.
No, it won't grow.
Oiling is a habit, oiling is a nature.
Hmm.
That the young girls they sit and the mothers sit behind them and they oil this thing, which is quite a nice gesture.
Mm-hmm.
Then they brush the hair. It is good for the hair for the shine.
Mm. Yeah,
ठीक है ना?
yeah.
But in
Okay.
nowadays, do you have that much of time? First, so you make your hair short because you work,
Mm-hmm.
right? Second is always better to shampoo, right?
Yeah.
Because in our mother's time, was the world so polluted? Tell me that.
Mm, yeah, yeah,
Did we
yeah.
have so much of hair problem?
Yeah.
Then did we have all these? nutraceuticals.
Yeah.
So now you have all these problems. Emotions. Smoking causes a lot of bad hair.
Mm-hmm.
So these are the things. So oiling is, I won't say oiling is bad. It's quite good as long as you have time. I would prefer you to oil your hair and then shampoo after some
Mm-hmm.
time.
Mm-hmm.
Okay.
Okay. Okay, quite interesting, doctor. So, like, putting lot of oil and thinking that it will grow, it is not true. Okay. So, doctor, now my favorite part. Can you give us some important tips for healthy hair?
Healthy hair is. Acha, how long will this take? Another 5 minutes?
Yeah.
Okay. Healthy hair, if you want, then you have to eat properly,
Mm-hmm.
proper healthy food.
Mm-hmm.
Then you have to sleep properly. You
Okay.
have to cut down on this caffeine and this Pepsis and colas and all these kind of things.
Mm-hmm.
Okay? Then you have to exercise. How
Oh.
can a hair be
Mm-hmm.
good only by taking nutraceuticals? It has to be nutraceuticals and also your proper health, right?
Mm-hmm. Yeah.
Right or wrong? That is
Right.
what I tell my patients, and that is how I'm doing it for the last 35 years, and patients have benefited by that.
Mm-hmm.
Understand? So
Yeah.
this I would always advise one thing: you have one hair, you still we don't have the artificial hair. So
Mm-hmm.
respect your hair before it is too late,
Yeah.
or finish it off and go straight for either the hair transplant or wearing those wigs, which is quite natural nowadays. I see a lot of these people. There is one joker in Bombay, and he jokes a lot.
Mm-hmm.
A fat guy. He
Mm-hmm.
wears a wig. I
Mm-hmm.
think he comes
Okay.
in this some show. Huh? He wears a
Uh-huh.
wig. I think he is
Mm-hmm.
bald. So that means hair is so important for the persona of a person, right?
Yeah, yeah.
Isn't it? Unless
Mm-hmm.
you shave it off and make it a style statement, it is very
Mm-hmm.
important, na?
Yeah.
So that is the way you move ahead. So hair, respect your hair till it's there, because after 10 years from now, I don't know what's going to happen because of the environment.
Mm-hmm. Yeah, yeah. The very interesting, doctor. This discussion was very informative. I'm sure our viewers have found the session very helpful. So, doctor, can we take some questions from our live audience?
Yes.
Yeah. So the first question is, hi doctor, my daughter is 12 years old and she have a lot of gray hair. So how can I treat it and why she have so many gray hairs at such a young age?
That is a genetic thing. Gray hair
Okay.
is also a misnomer. There is no gray hair. Is the hair gray?
Hmm.
Is my hair gray? It's white. Because that layer
Okay.
of pigment is not there. We call it graying of the hair. Just like
Okay.
your shirt does your shirt become small? No. You have
No.
overgrown your shirt, or you have
Okay.
overgrown your shoes. Your shoes have
Mm-hmm.
not become small. Your legs or
Okay.
feet has become big, right? So
Mm-hmm.
there is, first of all, there is nothing as gray hair. It's a
Mm-hmm.
white hair, and it's genetic.
Okay.
There are certain, you have a medicine called Cara Black, your company,
Mm-hmm. Okay.
right? So
Yeah.
that's a very good medicine for that, for the prevention of the graying of the hair.
Okay. Okay. Another question, doctor, from our audience is, doctor, I am having C grade hair and I want to go for transplant and I'm also diabetic. Is it possible?
See, first you have to consult your hair specialist. First you have to consult your doctor concerned and have
Hmm.
to place the facts in front of his table, in absolutely clear facts. And
Mm-hmm.
then you can take the last, you can take the calling shot of whether you want to go. Because always remember, if you're diabetic immunocompromised, for a hair transplant, to go for a hair transplant can be
Hmm.
quite risky, because it
Okay.
is not a 2 hours of age. It could be 4, 5, 6, 7 hours,
Okay.
right? So this
Mm-hmm.
is the whole thing.
Okay.
It's better to wear a wig.
Mm-hmm.
That is
Mm-hmm.
far better. Nowadays the wigs are very good
Okay.
instead
Okay.
of hair transplant.
Okay. Okay, I'll quickly take the last question from our audience. Hi, doctor. 2 years back, I got a burn accident, and due to that, I got a scar on side of my head, and it's not looking good. And I tried all the medicine. I visited many doctors, but the hair is not coming back. So, is there any solution for it, and how can I hide this?
It will not come back. If you lose your, if you lose the bulb of the hair,
Hmm.
if the bulb of the hair in the dermis is destroyed, how can it come back? Tell me that. How
Okay.
can your hair come back if the bulb, that is the root of the hair, is not there?
Okay. Okay. Okay.
Then you have to think of the other alternative is the hair transplant, which will
Okay. So
be
hair
implanted over
transplant.
there.
Okay.
Yeah,
Okay.
that, see, I have not seen the patient, neither can I comment that way. But if the question, as per the question, I'm answering the question. That
Okay.
is, if the burn is there, and I guess it's a 2 degree or 3 degree burn or whatever, even if
Mm-hmm.
it's the 1 degree burn, first degree burn, if
Mm-hmm.
you have the if the
A
hair
scar.
is bulb is not there, how will the hair come? Just be,
No.
it's common sense.
Okay.
You can do any damn thing. Then you have to go for the hair transplant.
Okay, doctor. Very interesting. So, finally, doctor, would you like to give a take-home message or any other suggestion to our viewers today?
Take home message is be happy
Mm,
and follow what I've told you all this time instead
mm,
of going to YouTube and all this rubbish which is of no use,
mm,
and follow this and
mm,
respect your hair till the
mm,
time it's there.
mm.
You understand?
Yeah,
What's the point of saying all these fancy things?
yeah,
The
yeah,
fact of the matter is, whatever I've told, this is all take home. You
yeah,
take it
yeah,
home.
yeah.
ठीक है ना?
Yes, doctor. Thank you so much, doctor, for sharing so much
Okay.
of expertise
Thank
and
you.
all the information with us today. I'm sure the viewers have found the session very helpful. Thank you, doctor. It was delight to have you, and thank you so much for your valuable time.
Thank you. Thank you very much. Thank you.
Thank you. Thank you, ladies and
Thank you.
gentlemen, for joining us today. We are signing off for today. Thank you, doctor. See